Now, the skill that we're about to learn, which is mouth care, requires some additional prep, and we actually have to do that before we wash our hands during the opening. So I'm going to bring you over here to this bed so I can show you what I mean. So this particular skill, our patient's going to be laying in bed, and we have to brush his teeth. Now, it's a live person. Of course, I don't have a live person here, so we're pretending there's somebody in this bed. It's a live person, and this person can't brush their own teeth for whatever reason, but they're laying down, and that is not a safe position to perform mouth care. So that means that we have to put the head of the bed up. We know we have to put the head of the bed up, but we have to figure out when in our whole opening scenario we should do that. So we're going to go in and introduce or identify our patient, introduce ourselves, tell the patient what skill we're going to do. We're going to get permission. But if we close that curtain and leave and wash our hands, when we come back to the bed, we have clean hands. Now, in order to put the head of the bed up on this bed, it's going to be located on the positioning rail, which is here. This is the positioning rail. So this button right here is for the head of the bed. This controls the head of the bed. So as you can see, I'm pushing the button and the head of the bed goes up. Now this is a hospital bed, so you'll actually see the knee come up a little bit too. But this takes quite a bit of time for the head of the bed to go up. And you have to continue to press this button until the bed is in the full upright position. So I've got to hold this button until it stops. Now let me take us down for a second so I can show you something. Let's say that during the test, you don't want to push the button for the whole time. So the patient's laying down, you come along, you push the button until it's right about here, and you think, okay, that's good enough. And you go wash your hands and get ready for the skill. This is not good enough. In healthcare, there is no such thing as good enough. It is either right or it is wrong. So you have to press this button until the head of the bed is in the full upright position, until it actually stops moving. Now, this isn't a cartoon. I know you guys have seen those Tom and Jerry cartoons or Roadrunner cartoons where they got it, somebody in a hospital bed, they push the button and it ejects them out. It's not a cartoon. No one is going to be ejected. I can keep pushing this button. Once it stops, I can push this button for the next hour. It's not going to do anything more. It's done. It has accomplished what it was going to accomplish. That's all it's going to do. It's not going to clamshell shut. It's not going to fold the patient in half. It's not going to do anything crazy like that. It will only go up a certain point and then it stops. But when you get the patient into a sitting position, I'm just going to move this down for a second so I can show you something. So when you get the patient in a sitting position, this pillow, if there was somebody in the bed, this pillow would be behind their head, which is super comfortable when you're laying down in bed, but not so comfortable when you're sitting up. If you've got a pillow behind your head, just your head, it pushes your head forward like this. So the back is against the bed, but the head is forward. This is not a safe position for mouth care. So what you have to do is have them lean forward and push the pillow down so it's behind their back, so the whole body sits up straight. So when you put the head of the bed up, don't forget to reposition the pillow down lower. Now, sometimes this isn't comfortable for the patient, though. If they've got a larger tummy, if they've had abdominal surgery, if they have breathing problems, if they have a lot of fluid accumulated in their abdomen, sitting up straight with a pillow behind their back may not be overly comfortable for them. In that case, just remove the pillow from the bed altogether, and that works just fine. There's usually a chair or somewhere you can put it, but don't leave it behind their head. That is not comfortable, but more importantly, it's not safe. But do we think that that bed controller is clean or dirty? Go ahead and type it in the chat. Is that bed controller clean or dirty? Yes, absolutely. It is dirty because everybody in the world touches that bed controller. Everybody has access to it. It is not clean. So we need to make sure that we're putting the head of the bed up at the right time, which would be before we wash our hands. So for mouth care, our opening is going to sound more like this. Knock, knock, knock. Hi, Mr. Jones. My name is Patty. I'm your CNA today, and I need to perform mouth care. Is that okay? I'm going to put the head of your bed up, and then I'll close the curtain, wash my hands, and then I'll go get my clean supplies. So you want to make sure that you're putting the head of the bed up before you go wash your hands. But I have drilled that opening into your head a million times by now, and you might forget because it's not part of our normal opening, right? You might go right into your routine opening, knock, knock, knock. Hi, Mr. Jones. My name is Patty. I'm here to brush your teeth. Is that okay? Close curtain, wash hands. Now, you might be over at the sink washing your hands. You might look over at the patient and go, uh-oh, I forgot to put the head of the bed up. So what do? Well, you have two options. You can either go put the head of the bed up and wash your hands again, but that takes a lot of time. Or you could just grab a paper towel and use it as a barrier between your clean hands and the bed controller. So if you forget to put the head of the bed up during your opening, it's not a big deal. Just make sure you remember that once your hands are clean, you don't want to touch that. So you'll use a barrier to control the head of the bed going up, and then throw that barrier away. All right, so let's take a look. This is our page for mouth care. So this is on page 66 of your skills book for those of you who have your book and are playing along. Our care plan, because we always start with the care plan says a resident with natural teeth is lying in bed and needs mouth care. The resident is not able to provide their own mouth care, so that means that we have to do it. Now below that, it shows you all of your supplies there. You'll see you need a barrier, toothbrush, toothpaste, towel, emesis basin, cup of water, and gloves. So I'm going to talk to you about those supplies in a minute. And then, of course, there's step-by-step instructions here. So when you're practicing at home, if you have this book open and you just follow these steps, you will be absolutely sure that you're doing it exactly the right way. Now, if you've got somebody at home that can read, so I wouldn't say, you know, like a really small child, but somebody that can read, give them this book. As you're performing the skill, if you get stuck, if you don't know what the next step is, just have them read it to you. That way they can prompt you and you can make sure you're doing the skill correctly. So let's look down here at the bottom, and you can see that this is a little bit longer skill. For the test, it says that this should take somewhere in the range of 12 minutes. So someone with your level of experience should be able to do this in 12 minutes or less. I want you to think about that, guys. How many of you have been brushing your teeth for several years now? And how many of you take 12 minutes to brush your teeth? Probably none of you. It's something that we get through very quickly. We don't even think about it. It's part of your normal daily routine. You could do this with your eyes closed, standing on one foot. It's just brushing teeth. So I don't want you to get like super scared about this or overanalyze it to death. This is easy. You're brushing teeth. Don't overcomplicate it. But it is, because it's being done on another person, it is going to require that we have setup and cleanup. So you have a lot of extra time there. You'll see that this is going to be done on a live patient. That means that you may be a patient and someone else might be brushing your teeth during the test. Remember that. You might be a patient for this during the test. Now that person is going to be in bed and charting is not required for this. Please remember that this is awkward for the patient. I know it's awkward for you. I know it's awkward for you, right? Nobody wants to brush somebody else's teeth. It's one of those skills that we'd rather do anything but brush somebody else's teeth. But if a patient can't brush their own teeth, this is a super, super, super important skill. Don't ignore this skill because you are uncomfortable with it. But understand that patient is just as uncomfortable with it. If a patient can brush their own teeth, they will. Okay, we only do skills for patients that can't do those skills for themselves. So if you've got a patient who can't get out of bed, but they can sit up and their hands work just fine, you're going to bring everything to them. They're going to brush their own teeth. So that would be mouth care, setup, and cleanup. So that means you bring everything to them, they do the brushing, we clean up after them. That's cool. You may have a patient that does everything their own, just like you, right? I didn't have to call you up this morning and walk you through brushing your own teeth. You've been doing it for years. You can do it yourself. I'm not involved in it. That would be mouth care ad lib, which means that the patient brushes their own teeth anytime they want to. We are not involved with that skill. Those are the care plans you want to see, right? They can do it themselves. But there are some patients who can't. Maybe they're confused or have dementia and they don't remember the process. Or maybe they have Parkinson's and their hands shake way too much to effectively brush their own teeth. Or maybe they have third-degree burns on both of their hands and they can't grip a toothbrush. There's a million reasons why somebody may need a healthcare provider to brush their teeth. We don't need to know what the reasons are. We just need to know that if the care plan tells us to brush someone's teeth, that we know to do it well and safely, and we do a good job. Okay? If they can't brush their own teeth, we need to do it. Let me tell you a story about this. Years and years ago, when I was working in the hospital, I was working in a step-down unit, and there was a young man who had been in a horrible motorcycle accident. He had hit a tree head-on, no helmet. It was a horrible situation, and he was paralyzed. He had been in ICU for many months, and he came to the step-down unit. And I noticed that when I tried to talk to him, he was actually paralyzed from like mid-chest down. But when I tried to talk to him, he turned his head to the side every time. He hardly talked at all. I kind of thought, well, maybe he's probably depressed, change of life circumstances, certainly appropriate. I was going to talk to the doctor about getting a psych consult. But I noticed that there was something very specific in the way that he turned his head when I talked to him. And I started thinking about it, and I asked him, I said, do you need somebody to help you with mouth care? Do you need us to do mouth care? And, because I'm thinking maybe he's, maybe something's going on. And he said, how do you put it? I think he said something like, I have dragon breath or something like that. And I started looking, and I could not find anywhere that anyone had done mouth care on him in several months. Now, can you imagine, right? This is horrible. I mean, this poor kid, he not only had his entire life turned upside down because he's paralyzed, but that is not the biggest concern of his right now. The biggest concern is the fact that his breath stinks because nobody has brushed his teeth. I mean, how mind-blowingly crazy is that we failed him at that one critical point? That there's no excuse for that. The fact that he's paralyzed should be up front and center. That should be the big headlight that he's concentrating on. But no, he was more concerned about the fact that his breath stunk because his mouth was scuzzy because nobody had been brushing his teeth. That's horrible. We should not be doing that to our patients, ever. So one of the things that concerned me here, and I know you guys are all going to think this, well, shouldn't it have been on the care plan? Well, sure, it should have been on the care plan. Certainly, he can't brush his own teeth. He's paralyzed from the mid-chest down, right? He can't lift his hands. Of course, he can't brush his teeth. But understand that the nurse, right, has to do that head-to-toe assessment. And right now, this kid had so many big, huge problems that the nurse was concentrating on. I mean, really big problems. Hemodynamic stability, autonomic dysreflexia. I mean, we have big problems, big fish to fry here, right? So is it possible that the nurse just didn't think about mouth care? Sure, it's absolutely possible. We're trying to keep the kid alive. We don't really care about his teeth at the moment. Her focus was way bigger than mouth care. But as a CNA, it's certainly appropriate for you to go to the nurse and say, hey, there's no mouth care on the care plan. Would you like me to do mouth care? I mean, do you want to put that on there? And the nurse could go, oh yeah, that needs to be done. Yes, absolutely. Let me add that in. So as a CNA, if you notice that basic daily maintenance is not ordered for your patient, you might want to speak up and let the nurse know, because remember that they have to think about all real problems and all potential problems. And the bigger the patient picture is, the more complex the patient is, the more higher level things that the nurse is concentrating on. And they're not going to think about all of the little daily activities that need to be done. So we rely on you. We need to work as a team. It shouldn't be a CNA going, oh, well, there's no mouth care ordered on this patient, I don't have to do it. I'm off easy on this. That's not taking care of the patient well. So it's not a CNA versus nurse. The CNA shouldn't go, oh, well, this idiot nurse didn't order it. It should be the CNA recognizing there's a need that wasn't addressed and bringing it to the nurse's attention so that the nurse can correct it. So the nurse can make sure that the patient gets all of the care that they need. We need to work together as a team for the best benefit of the patient. So understand your role in this. You're not creating the care plan, but you can bring things to the nurse's attention that can affect the care plan. Okay? So this patient can't do their own mouth care. Remember, if they can, that's a good day for us, right? Bonus. We can set up, we can clean up. If they can do their own mouth care, they're going to do their own mouth care. But if they can't, we've got to make sure we're doing a super good job at this, because we might be the only thing standing between serious dental disease when the patient doesn't need anything else going on in their life, and clean mouth that allows them to communicate well. Okay, so keep that in mind. Mouth care is important. But one of the other things with this skill, we're going to have to learn a brand new principle. So I'm going to bring you back over to our banners. Okay, so let's look at these banners real quick. We've learned the opening. We learned glove rules today. We learned barrier today. We know our skill rules. This is the one we're going to work on now, is basin cleaning. Now, anytime that we use something in healthcare for the patient, whether it's a wash basin, an emesis basin, a bedpan, anything that we use for the patient, we're going to have to clean before we put it back away. We don't put anything dirty away. But there's a difference between cleaning for the test and cleaning in a facility. And even more complex, there's going to be a difference between cleaning in facility A and cleaning in facility B. Okay, every facility is going to develop their own cleaning standards. There is no universal here. Some facilities are just going to have you rinse the basin out and put it away, because that's the patient's basin. That's the only person that uses that basin is the patient. So simply rinsing it out and putting it away is certainly appropriate. And some of your facilities will have you clean that way. Other facilities want you to take an extra step by cleaning it out with soap and water. And then there's other facilities that will have you spray a disinfectant on that piece, whatever it is, to fully disinfect it before we store it. Now, every facility is different, and every unit in the facility might be different based on the needs of that patient. If you're working in a chemo ward where we give patients chemotherapy, we absolutely strip their immune system when they're on chemotherapy. So we want to make sure that everything that's put away is absolutely decontaminated so that it doesn't have any opportunity to grow pathogens before the next use, because that keeps our patients safe. But if we're just in a home care setting, rinsing it is fine. It's just like your shower, right? You don't spray your shower with Lysol every single time you use it. You just rinse the soap off the walls before you get out. And once a week, you may go in there and do a deep clean. So every facility is going to have different cleaning standards, and every unit within the facility will have different cleaning standards based on the population of that unit. So we need to understand that we have to create a basin cleaning procedure that's going to work for all of those settings. And that's kind of hard because they're all different. So what you're going to see is that for the test, all we're required to do is rinse, dry, and store the item, no matter what it is. We're not disinfecting anything. We're simply rinsing it before and drying it before we put it away. And remember, these are single patient use items, so it's perfectly okay. But if you go to work in a facility that requires you to disinfect, I mean, how does that change the procedure? So the way you're going to see this done is we're going to dump whatever basin we're using, emesis basin, wash basin, bedpan. We're going to dump the contents where it would normally go. So if you're working with urine or feces or emesis, which is vomit, you would put that in the toilet because that's where it would normally go. If you're working with bathing water, that can go in the sink because there's no body fluids in it. Okay, so you're going to put it wherever it would normally go. And then you're just going to rinse it, dump the rinse water out, and this is where it changes. We're going to set the basin down because you're still holding that basin with hands that have not been washed, and they may even have soiled gloves on them. So if you have dirty hands or dirty gloves, you can't hold the basin with those dirty items while you're disinfecting it. You have to be hands off. So we're going to rinse it, set it down, and if your facility requires, that's when you would spray it. Now we still have dirty hands or dirty gloves. So we're going to get a barrier, which is a paper towel, to pick that basin up. And then we'll use a paper towel to dry the inside. We're going to throw that paper towel away and get a different paper towel to dry the outside. Now, why do we use a different paper towel? Because only the inside gets disinfected. So you don't want to cross over between a clean surface and a dirty surface without changing the drying medium, in this case, the paper towel. So basin cleaning is done the same for absolutely everything for the test. You're going to dump it where it would normally go. You're going to rinse the basin, dump it out, and set it down. For the test, we're not going to disinfect. We're not going to spray it. We're not going to clean it with soap and water, nothing like that. But if you were in a facility that required that, this is when you would spray it. Then we'll use a paper towel to pick it up, paper towel to dry the inside, paper towel to dry the outside. And now we've got to put that basin away in a drawer. Well, remember, you still have dirty gloves on or dirty hands, so we're going to get a paper towel to open the drawer to store our item. And then we'll throw those paper towels away. So again, basin cleaning, it's the same process, whether you're disinfecting or not. Same exact process. Dump, rinse, dump, set it down, spray it if needed, paper towel to pick it up, paper towel to dry the inside, paper towel to dry the outside, and one for the drawer. Then we'll throw all the paper towels away at the end. And then after you're done with all your cleanup, you can remove your gloves. But you can't remove your gloves before that point. Okay, we'll talk about why in a little bit. Okay, so let's say that we get into this skill and I do my opening, I put the head of the bed up, I wash my hands, I get my barrier, I get everything, but I forgot the towel. Okay, so, and I'll get into the supplies in just a minute, but let's say I forgot the towel. And I get my toothpaste on my toothbrush, and I get my gloves on, and I go to brush teeth, and right as I get there, I realize he doesn't have a towel on. Well, I can say, correction, I would have gotten a towel, but that doesn't solve the problem that he still doesn't have a towel. And trust me, we're going to get stuff everywhere when we're brushing somebody's teeth in bed. It's a messy, messy thing. So I don't want all of that stuff on his clothing. That's just irresponsible. So now what I'm going to have to do is remove my gloves, go wash my hands, get the towel, get a new set of gloves, put the towel on the chest, put my gloves on, and then resume. So we have to address the problem. Okay, you're not graded on that. So there's no checkpoint. Okay, remember that checklist? There's no checkpoint that says candidate got appropriate amount of supplies. There's nothing to check off there. What you're graded on is what you do with those supplies. So if you forget something, you've got to get it, because by not getting it, that means there's a step you can't do, and that's what you're going to be graded on. So you have to stop and get those supplies that you need, whatever it is that you forgot. But here's where it gets tricky. You've got to figure out, are your hands clean or dirty? So what point of the skill are you at? And then you've got to figure out whether you can even get into the supply cabinet with those hands. So if you've already touched a bunch of stuff and your hands are dirty, or you already have gloves on, you can't reach into that supply cabinet. You have to remove your gloves, wash your hands, and get clean hands to get whatever supplies you need. Remember that that supply closet is clean only. We can't have dirty in there at all, because it contaminates the whole thing. So you've got to figure out, are my hands clean or dirty? Do I have gloves on? If you have gloves on, you have to remove them and wash your hands. If your hands are still clean, just go get whatever it is you need if you haven't started the skill. If you're halfway through the skill, you're going to have to stop, wash your hands, get whatever you need, and then resume. So just so that you guys understand where we're at, right? I told you there's 11 principles we have to learn, right? There's 5 right there that we already know. Let's turn the camera a little bit. We're going to learn washing rules in a little while. We're going to learn scoot and roll on Monday. We've already learned privacy blanket. We still have to learn linen rules and shoe rules, but we know the closing. So right now, you are over halfway through all the principles, and it's only class 2. Not even over yet. So it's very easy to learn these principles and learn how to adapt them into the skills that we're learning. And that's what makes this class easy to master, okay? All right, so let me show you mouth care. I'm going to show you the video for this. Pay attention to the basin cleaning, because you're actually going to see it in this skill from beginning to end. So pay attention to that. And watch when I put the head of the bed up.